Hey, this is Dr. Kaan of the ACL Academy, and today I want to touch a little bit more on time commitment for your ACL recovery process and what it takes to really return to who you once were and all sports and activities that you were doing before your injury. Guys, if you found some value out of our channel, please subscribe to it. Please like the video. More importantly, share with a fellow ACLer that can benefit from these tips and education that we put out weekly. So, a lot of questions that I get come around the time commitment. And, when you're talking about ACL recovery, especially post surgery, you'll hear numbers thrown out like, oh, it's a 9-month recovery to a year recovery. And yeah, those are general time frames to utilize. It's important that we look at this recovery process in two ways, right? It's not just the time itself, meaning when we replace your ACL, right? We don't repair it. It's an ACL reconstruction, so we replace it with another piece of tissue. In most cases, that's a piece of your own tissue, which is a tendon. A tendon has to go through a process in order to form what we will known as your new ACL ligament. Okay, this process we know can take a year or longer, and really the earliest that we feel confident with this healing time process is at that 9-month mark, and that's why you hear that number more often than not. That's one side of it. The other side of it is physically when you're ready and able to return. This is more important. As time can pass, that new tendon, which is becoming a ligament, can go through that process. But if you don't have the muscles to support that knee joint, well, you're setting yourself up for failure. And where most people miss the boat is they're not doing their formal and objective testing along the way. And that's not your fault as a patient. That's the provider's really positioned to make sure that they are educating you about this and testing you along the way. So this way they can track your progress, track your numbers, and know that you're getting strong all around, not only side to side, but also for your height and your body weight, as this will be more the determination factor of when we can return. So that's where I want you to look at it from a timeline perspective. Yes, there are two pieces. There's the healing time frames that we must respect, but more importantly, there's the physical time frames that need to be met, need to be assessed objectively so that we know that you are meeting those requirements. Now, the other question that I get mostly is, well, what's the time commitment take? Meaning, how much work do we have to put in? Not all of us are full-time athletes. Not all of us are professional collegiate athletes where this is our jobs to get back to our sport. Some of us are weekend warriors. Some of us are high-level athletes, but also have jobs, also have families. So, when we go for this surgery, big question is I get is, well, what does it take? So the way that I put this to our clients here is it is a 7-day process. It doesn't mean it's going to take over all your time, but at the same time, you need to do a little bit for your knee every single day. And that is something you need to know and accept going into surgery, because if you don't, it's not worth it because you will be disappointed with your outcome. Now, when I talk about time commitments, usually we're looking at two pillars of this. One is the mobility aspect of it, right? Getting our motion back, our extension, our flexion back. This is obviously very, very important in the beginning, and to be able to get that motion as soon as we can, but also to keep it and maintain it as stiffness lingers throughout the process. Some people can complain of stiffness for months at a time, even when they have the full motion. So this, from a mobility piece, needs to be done every single day. Most cases, what we do is we split our mobility programs with our clients into extension work, so straightening work, right, getting our knee nice and straight, and flexion work, getting our knee bending fully. Now, these programs can take anywhere from 10 to 15 minutes each per day. So you're looking at a volume of 20 to 30 minutes of mobility work each and every single day. And this is majority of the times the recommendation that we make in these cases. The reason being, it's not only important that it helps us obtain our motion faster, right? The more we move it at a high volume, very consistently on a daily basis, you're going to get that motion back quicker. But number two, because our knee is healing, scar tissue is forming, we want blood flow to that new tissue, right? That's going to help with the mobility and the fluidity of the joint. So the more we move it, the more blood flow goes there. And that's why it's so important that this mobility work is done daily. So your mobility piece, 20 to 30 minutes per day. And that's usually for the whole recovery process. Now that can fluctuate up and down depending on how fast your motion is coming back, how tight and stiff you are. Some people will gain motion very quickly. Some people scar down very quickly and get stiff, and it'll be harder to work through. So they may have to work a little bit harder. We don't know until you're going through the process, but that's why we set everybody up and make sure that every single day they are moving their knee from end range to end range. The second piece, right, the second big pillar will be your strength, right? This will obviously kick in right away, but as you're getting your motion back, it's coming into return. We'll get into like a full gym program. So in these cases, what I usually like to do is if you're fresh post-op, we probably will do some strength work every day or every other day. And these will be shorter programs consisting of half hour to 45 minutes. Now, as our motion comes back, we're moving a little better, we're walking, let's say going up and down stairs okay. These are the time where we transition to a gym program, which could be anywhere from the 1 month mark, 6 week mark, 8 week mark, depending again how you're progressing along. Once we get you into the gym, at that point, we're starting to move weight, right? So recovery days are just as important. So in these cases, what I usually like to do is a 3-day or 4-day split, where we are working out 3 to 4 times a week, but we're also giving our muscles and our joints additional time to rest in between. And the reason being is when we are lifting, we want to load as much as we feel capable of doing, as much as the knee lets us load. So we're really pushing strength, right? But at the same time, after those workouts, we're giving our body, our joint, our muscles, enough sufficient time to recoup and recover. So this way, that next workout, we can push further along. Okay, now that will continue, right? That could be 3, 4, 5 months of really pushing strength. And then at that point, when your strength numbers are up, because we're assessing them, right? As I said in the beginning, we're going to strength test you objectively, see how your strength numbers are looking, how they look side to side, how both legs look compared to your body weight. And as you're reaching some ideal numbers, making the legs match, well, that's when more dynamic stuff will start. So depending on like your sport, your activity, what you're looking to get back to, we can initiate running. We would initiate some agilities or plyometrics and things of that nature. Again, depending on the sport, where at that path you're looking to go. When we're talking about foundational work or ACL recovery, if you want it to be successful, you're looking at 7 days a week, okay? 20 to 30 minutes per day of daily mobility work, and strength work will most likely be 3 to 4 times a week, 45 minutes to an hour. That's the time commitment, and that you have to be in it for the long haul. And I have this conversation a lot. I love when I get a chance to talk to people, right after their injury and they're deciding if surgery or not. So this way they understand the time commitment. A lot of people go into surgery and their doctors don't inform them this, their physical therapists don't inform them this, their trainers don't inform them this, that it is hard work. It's going to take daily work. You have to make it a priority. You have to make it a commitment, especially if you're trying to return to a sport, if you're looking to return to your previous level of activity, if you want to be just as active as you before. Otherwise, you're going to have this surgery, which is the first step of 1,000, right? And then you're going to set yourself up for failure because you're going to be overwhelmed, not going to appreciate the time commitment needed. You're going to go through 3-4 months of rehab, and then you're going to say, it's good enough, and then your knee is never going to be the same. There's so many people that we talk to who are years out who never reached that full potential because they didn't do the rehab process the right way. They weren't guided the right way. And now they're left with a stiff or weak knee and more work to do. So super important. You guys understand that from both perspectives. One, the length of time, right, is dependent on 2 variables. One is the healing time. That new ACL replacement takes time to turn to your new ACL. And the second piece is physically, right, reaching the milestones. And that's because you're formally and objectively assessed and tested along the way, making sure your numbers are climbing, you're reaching the milestones that you should be reaching, not only side to side, but also per your body weight. And then the day in and day out work, right? 7 days a week, mobility work, short mobility programs daily to make sure we're moving end range to end range. And then you're looking at strength work 3 to 4 times a week. So that's the time commitment. You have to be in it for the long haul, meaning it could be up to a year, right, where you're putting in this process. So when you're going for surgery, it's a really, really important thing to watch. This way you understand that concept. Hope that makes sense, guys. If you have some questions, drop them below. If you found value here, please like the video. Of course, if you can, subscribe to the channel. We really appreciate it. And more importantly, share with somebody else who is going through this injury that could benefit from these tips and education. We put out a weekly video every single Monday. This is Dr. Kaan of the ACL Academy, signing off.